Now, Nigeria's health sector is once again facing a crisis amidst the onset of a third wave of COVID-19, as resident doctors have begun another strike to press for, as usual, improved welfare. At this time, it is indefinite. Evelyn Akaka reports.
If contending with the coronavirus pandemic wasn't enough, Nigeria's hospitals are about to face even more challenges. Resident doctors across the country are going on strike. They're fighting for better working conditions and are demanding payment of overdue salaries and allowances. They say the government isn't listening to their demands. These doctors account for more than 80% of the medical workforce. Without their support, consultants can't manage the workload and patients are left unattended to.
Some state government also have not paid its members, some owing them up to 19 months, some 10 months. And these are part of the things which government had agreed they were going to intervene, to ensure that our members were paid. Beyond that also is the Residency Training Act, which government also had agreed they were also going to pay, which we are yet to see for 2021 year.
Many of the problems facing the healthcare system can be linked to a lack of proper funding. Less than 4% of Nigeria's 2021 budget is allocated to health. That's despite a pledge made in 2001 to allocate 15% of the budget to healthcare. This is the third time this year resident doctors are going on strike, but it's changed little in the past. These resident doctors now want long-term solutions from the government.
Government also needs to do the same thing which we have in the judiciary, where a certain percentage of the budget, a substantial amount of budget, is constantly kept exclusively for healthcare. It has to deal with remunerations of staff, equipment, creation of maintenance of equipment, and it should not just only be limited to the federal government. It should also span down to state governments.
Millions of Nigerians struggle to gain access to adequate public health services, which are often free in other countries. Now, resident doctors are hoping their strike action forces the government into improving healthcare for all. Evelyn Akaka, ARISE News.
And for more on this, we're now being joined by Dr. Aziz OJEKUNLE, President, Association of Resident Doctors, Lagos State University Teaching Hospital. Good to have you, Doctor. Now,
good afternoon. Thank you.
Good afternoon. Now, let me just ask to set things going. Are we in danger of blunting the sword through overuse? So if we continually embark on strikes, are we in danger of rendering that strike action unfruitful because maybe the system gets used to operating without us?
Yes, again, thank you for. This is a case of acute crisis. It's a case in which, as much we've displayed hesitancy in embarking on this suspended industrial strike action, it's becoming something that is tarnishing the image of the profession, which we have been seeing synonymous to industrial strike action. But this appears to be the only language that the government, who is in power and in charge to meet our demands, tend to listen to. We've explored and found out that the aspect of dialoguing, lobbying, advocacy, and discussion with meetings seems not yielding the results which are essential to quality healthcare system delivery in our country. And this appears to result in this recurring strike action, which is quite unfortunate, and we find ourselves in this scenario.
But Dr. Aziz, if you don't mind my pushing, are they actually listening to this language? Because the fact that you have to keep relying on it or recoursing to it suggests that perhaps it's not effective.
That is the challenge, and that is like the last among our armamentarium to address this pending issue in the health sector. We've had dialogues, discussion at national level, memorandums of action has been signed while awaiting implementation. Despite that, none is being done yet. And it appears as if even that is it's only doing industrial action that they tend to appear to listen and come to the round table to negotiate and discuss way forward on how to improve our healthcare system. And that is why it often shows as if that is what we are using currently, which is an unfortunate scenario that we found ourselves.
All right, Dr. OJEKUNLE, let me pick it up from where my colleague actually ended with a discussion. So this time around, we know a strike action has been instituted. What are the issues on the table right now?
We have chronic issues on ground, which led to the suspension of the strike some months ago. And since then, other issues have climbed on it acutely. First is the aspect of a circular that was released by the federal government, but first implemented by the Lagos state government, resulting in the stipulating the removal of the cadre of doctors known as the house officers from the scheme of service. These are licensed medical doctors that work and are supposed to enjoy the benefits of civil servants. Now they are being removed and deemed fit to be given only allowances as remuneration. This is quite injurious to the healthcare system. Also, there is the role of the Medical Residency Training Act, an act that has been passed into law from the federal government, yet to be implemented across many states. There are states that are yet to even have it implemented. Here in Lagos State, process has been commenced. However, this is taking too long. We want results as soon as possible. There are other states across the nation who are being owed salary, some extending to 18 months in Abia, some in Imo State. Some of our members are being owed arrears. Likewise, the aspect of recruitment. As you know, there is current massive brain drain. Many of our colleagues are leaving the shores of this country for greener pastures. Those that are left, we have very short manpower, and we'll be advocating for recruitment, the need for mass recruitment for resident doctors, medical officers, and even increasing the quotas for house officers, such that we'll be able to meet up with the demands of clinical service delivery. Currently, the ratio of doctors to patients is not even at par to what is expected as minimum in other climes in the global world. Likewise, here in Lagos State, as the name implies, we're supposed to be residential within the premise, such that service delivery will be immediate and prompt. We've been on this aspect, the issue of residential quarters project for years. We need this project to be implemented. These are issues that affect us both at state level, across the nation, and even at federal level, federal tertiary health institutions. We are willing to return to work. We are so hesitant to embark on this because we know the patients bear the brunt of this, which is a situation where the government is to be blamed for this. We're advocating and pleading that they should yield to ensuring implementation of the demands, not just in the interest of our members, but in the best interest of the Nigerian citizen, especially the healthcare system portfolio.
No, but if I were to pick up on your last statement or piggyback on your last statement, of course, we know that you swore to the Hippocratic oath to save lives. But when strike actions like this become the order of the day and become a recurring decimal, then you're almost contradicting that particular oath.
This is the situation where the government have made us to find ourselves. A saved life is needed to save another life. For the healthcare provider, we need to be in optimal and well-motivated frame of mind, psychologically, emotionally, financially, to be able to cater as a healthcare provider. Yes, even the oath in the renewed session stated that I will attend to my needs as much as possible so that I'll be able to attend to the needs of the patient. We need to be in optimal frame of mind. We need to be working in a conducive environment. The structure of the healthcare system needs to be in good place such that we can deliver optimally.